Hello, my name is Ian Sexton. I'm Professional Services Manager here at Number 7 Contact Lenses, part of the Cooper Vision Group. In this short presentation, we're going to discuss the more advanced features of our Comfort 15 mini scleral contact lens. The Comfort 15 design, which some of you may be familiar with, was originally designed as a simple, low-cost, entry-level mini scleral lens, and it's been very successful in this role. However, as part of our ongoing research and development of the lens itself, and at the request of some of our practitioners, some new features have been developed. If you're not familiar with the standard Comfort 15, then familiarise yourself with that lens first. These more advanced features will be able to help you fit a wider range of patients with a wider range of ocular conditions. Because of this, we've developed a new range of diagnostic lenses to help with this overall fitting process. So we know from our practitioners that patients who are post-graft or post-refractive surgery generally have a very flat cornea in the centre, while their peripheral cornea and limbus remains very similar and very normal in appearance. Now, the shape of this eye, where it becomes steeper in the periphery, is known as an oblate cornea. This creates a very special set of circumstances, and we need to make changes to the lens design to be able to fit this type of eye effectively. The patients with these kind of flatter central cornea, when we use the standard Comfort 15, produces a fluorescein pattern very similar to the one that you can see in the image. We'll often have some kind of mid-peripheral bearing and certainly lots and lots of central clearance, which we can see here with this excessively thick, bright fluorescein layer. Another indication that we have a very flat treatment zone is a relatively high negative over-refraction. So we started looking at how we could help practitioners and patients with the Comfort 15 with these very flat oblate cornea. It's possible for us to produce some reverse geometry curves on the back surface of the lens. So this means that the central curve is flatter than the surrounding area compared to a standard lens where it tends to be steeper. So using this flatter base curve creates a fitting relationship where we reduce the central clearance to a much more normal and effective thickness. When we're fitting our oblate cornea, we use a standard Comfort 15 design. It will show this large amount of central clearance and maybe even some mid-peripheral touch. Depending on how heavy and how wide the area of touch and how thick the central clearance is, will help us to determine how much reverse geometry we need to put onto the back surface of the lens. In the first instance, we'd suggest that we try 5 diopters of reverse geometry. If it's very heavy or the clearance is very high, then possibly 10 diopters may be necessary. At the collection appointment, when we apply the lens to the patient's eye, we'll see that this flattened central curve should eliminate the mid-peripheral bearing and touch and also reduce the amount of central clearance that we have. The technical department, when you order the lens, will make adjustments to the power of the lens to compensate for the change in power caused by the flattening of the base curve. So you don't have to worry about working out power changes. We will do that for you. So there are several reasons as to why a toric periphery lens is required. The first one is if we are finding that we have a toroidal over-refraction. Now, it's relatively easy for us to manufacture a front surface toric in the Comfort 15 design, but we do need to have a method of stabilization. We found as part of our research process that prism ballast was not very effective and made the lens much less comfortable. So a toric periphery, where the depth of the edge varies, helps us to stabilize the rotation of the lens and enables us then to put the front surface sill in the correct direction. The other instance where we need to create a toric periphery lens is if we're seeing some kind of sectoral impingement or vessel blanching. This would tend to indicate that the scleral toricity closer to the limbus is higher than average, and we need to compensate for this in the edge design of the lens. As a standard, the Comfort 15 is manufactured with 200 microns of eccentricity at the edge, but this can be varied up to a maximum of 400 microns. When we supply you with a toric periphery lens, you'll notice that there are some markings at the edge of the lens. Now this may be in the form of 2 dashes or 4 dots. These markings indicate the flat meridian of the lens. So what we do is we place the lens on eye, allow it to stabilize for 60 minutes as we would do normally, and then we see where the axis of rotational stability is of those flat markings. It's always worthwhile just checking that rotation by spinning the lens manually away from the stable axis, and then just watch it move back with blinks and ensure that it returns to the same position. And we record that as part of our assessment criteria. So once we've allowed the lens to stabilize for 60 minutes, we've checked the axis of rotational stability. We now want to place the order with the technical department. The information that we need from you is the axis of rotational stability, the normal sag of the lens that you've chosen as a diagnostic, your sphere seal over-refraction. So as an example, say we used a 4000 micron sag lens. The lens itself stabilized at 60 degrees, and we found out over-refraction was -1, -175, axis 180. If we give this information to the technical department, they will then process this order and place it with the lab, who will then manufacture the lens for us. When the lenses arrive back at your practice, we apply the lenses to the patient's eye in the normal way and allow 60 minutes for stabilization, as we would do with any other mini-scleral lens. After the 60 minutes have passed, check that those flat axis marks are orientated in the same direction as they were as part of the diagnostic process. Assess the clearance in exactly the same way to make sure it's optimal, and check visual acuity as you would do normally. So there is nothing different other than we're just looking to check the orientation of those flat axis marks. If we've ordered a Comfort 15 toric periphery for sectoral impingement, again it's exactly the same process. We insert the lens, allow it to settle for 60 minutes, check the central clearance and visual acuity in exactly the same way, and just look at the edge of the lenses to make sure that they are aligning, laying flat on the sclera, and again that the orientation marks are in the same position as we were when we did the initial fitting. So I hope you found this short presentation on the advanced features of Comfort 15 useful. Please feel free to give us a call or drop us an email at the office if you do have any technical queries or would like any assistance with the fitting process. Thank you very much for your attention,